Hello and welcome students. Welcome to the lecture number 4 of the subject GRP, Good Regulatory Practices. And as you must be knowing that we are discussing about good automated laboratory practices. Now at the onset I would like to clarify one thing, that when we are discussing about laboratory, in our context, definitely we are talking about the pharmaceutical industry, but this particular guideline, that is good automated laboratory practices, can be applied to various other fields in which experimental data are taken in laboratory. For example, engineering field, aerospace research, microbiology, biotechnology, etc. So in our context, we are talking about pharmaceutical industry, but the guidelines are also applicable to any laboratories which are handling experimental data. So continue with the guidelines given by GRP and GALP document. The next set of guidelines are about comprehensive testing. Now, the testing here is in context with the LIMS system, that when LIMS raw data are collected, analyzed, processed or maintained, laboratory management shall ensure that comprehensive testing of LIMS performance is conducted. Here in this guideline, we are talking about the performance audit of LIMS system, which includes both software as well as hardware. And when this comprehensive testing is needed or when we are supposed to perform it, so whenever we are making any change in old software or hardware, upon modification of software and hardware, we are supposed to carry out a comprehensive testing to ensure the performance of LIMS and thus ensuring the integrity of data. These tests shall be documented and documentation shall be retained and available for inspection or audit. So when at the end of the tenure, when we are facing US FDA inspection, they may ask you the documentation pertaining to the comprehensive testing. So no matter at what frequency you are doing this comprehensive testing, it is compulsory to maintain proper documentation, and this documentation should be produced during the audit or during the inspection by any external agency. The next set of guidelines are about how to retain records. And when we say records, we are talking about experimental data, standard operating procedures, as well as other documentation. So it says laboratory management shall ensure that retention of LIMS raw data, documentation and records pertaining to the LIMS comply with EPA contract, statute or regulation, and standard operating procedures for retention are documented, maintained and managed. Now it is a job of laboratory management to ensure a systematic retention of records. In case the laboratory management is not aware of how to retain records, specific guidelines are given by authorities. So one can always refer various guidelines, various rules pertaining to the record retention, and according to that they can store record so that they can ensure the safety as well as integrity of recorded data. Also, we must understand that the entire process should be documented properly, and that documentation is also preserved properly. Next set of guidelines are about facilities. Now, These facilities are mainly associated with the facilities needed to operate software and hardware in an efficient way. So it is a job of laboratory management to ensure that the environmental conditions of the facility housing the LIMS are regulated to protect against LIMS raw data loss. Now, in a nutshell, you can understand it in this way, that normally when we are using computers, when we are using these digital systems, we are ensuring a dust-free environment. Air conditioned room or laboratory is preferred, and a complete dust free environment is needed in order to ensure the most efficient work of computer system. Suppose we are not following proper guidelines, so it may lead to the malfunction of computer system, and that will eventually lead to the loss of LIMS raw data. So in order to avoid loss of LIMS raw data, we must ensure that the facilities are suitable for the optimum operation of software as well as hardware, and it is a job of laboratory management to ensure such facility where the LIMS is being operated. Environmentally adequate storage capability for retention of LIMS raw data, LIMS raw data storage media, documentation and record pertaining to the LIMS are provided. Many times we have seen that due to the fire hazard or due to any other hazard, in a company there is a considerable loss of documentation or a considerable loss of data. So it is a job of laboratory management to develop and ensure such facilities which are proof of such unwanted things and which can protect the LIMS raw data as well as other documentation in a proper way. The next set of guidelines are specifically pertaining to the standard operating procedures. Now, the standard operating procedures are not only limited to LIMS, but whenever you go in any pharmaceutical industry, each and every department is having standard operating procedure. So it has become a very integral part of the quality aspect in specifically the pharmaceutical industries. So laboratory management shall ensure each current standard operating procedures, that is SOP, shall be readily available where the procedure is performed. A person who is operating LIMS must have standard operating procedure in front of him, or he must be able to access the approved standard operating procedure in order to perform his duty properly. Standard operating procedures are periodically reviewed at a frequency adequate to ensure that they accurately describe the current procedures. Now, whenever we are preparing standard operating procedure, we must add a date of review. If you are making any particular change in LIMS system, whether it is the software or hardware, you must review the standard operating procedure after the maintenance work, and if needed, you are authorized to make a suitable change in the standard operating procedure. So make sure that the standard operating procedures are reviewed periodically, and if necessary they should be changed or they should be incorporated with the change in the system. Okay, so that was all about some general guidelines regarding how to set laboratory, what kind of documentation we are supposed to make, what kind of software, hardware we are supposed to purchase, and how to develop an overall facility to ensure the maximum integrity of data. Now, this particular part is very important, that is 21st CFR part 11. Now what is CFR? So CFR is a code of federal regulation. So in US FDA you will find different CFRs. So these are nothing but instructions or somewhere you can read them as guidance, right? So guidance or instructions given by US FDA to various people or institutions or pharmaceutical industries in order to perform their duties properly. Now this particular part of CFR, that is 21st CFR part 11, is mainly associated with the electronic records, electronic signatures. So you can say that when someone is referring 21st CFR part 11, it gives guidance or it gives instructions pertaining to the preparation, maintenance and retention of electronic records and electronic signatures. This document provides guidance to persons who maintain records or submit information to FDA, have chosen to maintain the record or submit designated information electronically, and as a result have become subject to part 11. So as I said earlier that when someone is operating LIMS, the entire data is available in the form of electronic data, and when a person or an organization is submitting that electronic data to US FDA during the inspection, the guidelines or the instructions they are supposed to follow are given in 21st CFR part 11. Part 11 applies to records in electronic form that are created, modified, maintained, achieved, retrieved or transmitted under any records requirements set forth in agency regulations. So here they have given a brief classification that it is not only the record or the data which is created, but suppose you are inherited some other data, you are maintaining data of some other organization, so or you have archived some data. So all sets of electronic data are part of 21st CFR part 11, and various agencies, here in our case it is US FDA, has specifically mentioned different types of electronics data in part 11 guidelines. Part 11 also applies to electronic records submitted to the agency under the Federal Food, Drug and Cosmetic Act and the Public Health Service Act, even if such records are not specifically identified in agency regulations, which means this particular part or the instructions given in 21st CFR part 11 is not only limited to the pharmaceutical product, but it is also related to the cosmetic products as well as food products or any other product which directly or indirectly affects the public health, and that comes under the Public Health Service Act, that is also known as PHS Act. Now, overall approach to part 11 requirements. Now, suppose you are working in a laboratory and you are the person who will be able to or who will be authorized to submit electronic data and electronic signatures to the US FDA. So this particular portion of the guideline tells you some instruction, or it will try to clarify your doubt that how should you perceive these instructions or guidance given in 21st CFR of part 11. Then narrow interpretation of scope. Now please remember that when someone is working in the domain of 21st CFR part 11, he or she must know that what kind of data should be covered in part 11 and what kind of data are not suitable for the instruction or guidance given in 21st CFR part 11. So when a person choose to use record in electronic format in place of paper format, part 11 would apply. So suppose you are not submitting physical document, but instead you are submitting data into disk form or in pen drive mode or in any kind of digital format, so that would comes under the 21st CFR part 11. On the other hand, when person use computers to generate paper printouts of electronic record and those paper records meet all the requirements of the applicable predicate rule, and persons rely on the paper record to perform their regulatory activities, FDA would generally not consider persons to be using electronic records in line with paper records under 11.2 and 11.2b, which means if during the inspection or if during the submission, instead of submitting electronic data, if you are taking printouts of that electronic data and you are submitting a hard copy of electronic data, the US FDA or the other agencies would not consider that data under Part 11. So make sure that the data you are submitting is only and only in the digital form, then only it would be a part of 21st CFR Part 11. Any kind of hard copy or any kind of physical documentation of electronic data will not be qualified under Part 11. In this instance, the use of computer system in the generation of paper record would not trigger Part 11. As I said, even though the data is originally in electronic form, but the submission is in a hard form, it would not trigger Part 11. Next is the definition of Part 11 records, that what kind of data you can define as record. So records that are required to be maintained under predicate rule. Here the predicate rule means the instructions given by US FDA under 21st CFR Part 11. Requirements and that are maintained in electronic format in place of paper format. So specific instructions have been given to the person who are working in laboratory, that what kind of data should be stored in electronic format and what kind of data should be stored in a form of physical copy. So any data which is prepared, stored or maintained in electronic form is considered as a Part 11 data. Records that are required to be maintained under predicate rules that are maintained in electronic format in addition to paper format and that are relied on the perform regulated activities. In some cases, the laboratory management may ask you to maintain electronic data as well as the hard copy of that data. So that also considers as a part of 21st CFR Part 11 guidance, or you can say instructions. Records submitted to FDA under predicate rule in electronic format, assuming the record have been identified in docket number as the types of submission and the agency accepts in electronic format. So normally when we are uploading electronic data onto the servers of US FDA, we have been given specific docket number, or we are supposed to put our data in a specific docket number. So all those kind of data is considered as a record in Part 11 guidance. However, a record that is not itself submitted but is used in generating a submission is not Part 11 record unless it is otherwise required to be maintained under a predicate rule and it is maintained in electronic format. Suppose we are preparing a set of data by using some other set of data which is not the final set of data. So here in Part 11, as per the US FDA, they say that the only final data in electronic form would be considered. Suppose you are using some secondary data to prepare primary data, that secondary data would not be considered as the electronic record as per the instructions given in Part 11. Electronic signatures that are intended to be the equivalent of handwritten signatures, initials and other general signings required by predicate rule. Definitely when we are submitting data in electronic form, the authorized signatures are also submitted in electronic form. So if such signatures are submitted in electronic form, they can be considered as a record as per the Part 11 guidance. Part 11 signatures include electronic signatures that are used, for example, to document the fact that certain events or actions occurred in accordance with the predicate rule. So same thing they are repeating here, that a digital signature can be considered as a record in case of 21st CFR part 11. Next is how to practice the guidance or the instructions given in 21st CFR part 11. So first is the validation. So here they are asking us to validate our LIMS system periodically before submitting the electronically generated data. So the agency intends to exercise enforcement discretion regarding specific part of 11 requirement for validation of computerized system. So here the agency can use their authority and they can ask you to carry out validation of your computer system. You should also consider the impact of those systems might have on the accuracy, reliability, integrity, availability and authenticity of required records and signatures. So even if the agency is not asking you to carry out validation, but suppose you are carrying out validation of your computerized system, it would ensure the accuracy, reliability, integrity, availability and authenticity of record. That means validation is very important operation. Audit trail. Audit trail, see, first you have to understand what is the meaning of audit trail. So audit trails are nothing but a step by step process of completing the entire audit, and each step we have to document properly so that we can trace back to a particular step. So that is called trail. So the agency intends to exercise enforcement discretion regarding specific Part 11 requirements related to computer-generated time-stamped audit trail. Whenever we are doing any action or whenever we are performing anything on LIMS, whether it is the validation or audit, we must put a time stamp. So it must have time and the date at which the validation or the audit had been carried out. Persons must still comply with all applicable predicate rule requirement related to documentation of, for example, date, time or sequencing of events, as well as any requirements for ensuring that changes to record do not obscure previous entries, which means the entire audit process should be done step by step. Every step has a time stamp that on which date and a specific time you have to mention that the performance has been done on a so and so date, and this entire documentation you must retain in a very proper manner so that it would generate a proper audit trail, and this audit trail is mainly asked by the US FDA persons when they are coming for the inspection. So this audit trail is nothing but a step-by-step generation of documentation with proper timestamp so that you can trace back to any particular step and you can check that on which date it had performed and who had performed that particular step. Audit trails can be particularly appropriate when users are expected to create, modify or delete regulated records during normal operation. So what happens in case of normal operation, that sometimes we have to delete or we have to modify LIMS raw data. So the moment we try to delete or the moment we try to modify that particular data, that is LIMS raw data, we must make a proper documentation that what was the need for doing that and why we are doing that and who had done that. So this kind of information we have to maintain, and that is why audit trail is very important. Then the legacy system. So these particular guidelines or instructions are related with the legal consequences or the legal steps which are associated with the electronic data. So this means that the agency does not intend to take enforcement action to enforce compliance with any Part 11 requirement if the following criteria are met for a specific system. Suppose you are following specific guidelines or the steps given here, the agency will not take any legal action or they will not use their authority. But suppose you are not following these steps properly, then the agency has authority to take some legal action against you. So what kind of steps we are supposed to follow? So the system was operational before the effective date. The system met all applicable predicate rule requirements before the effective date. The system currently meets all applicable predicate rule requirement. You have documented evidence and justification that the system is fit for the intended use. In short, if your system is working properly, if you are using proper software and hardware, if you are maintaining documentation properly, and if you are doing validation properly, then the agency will not take any legal action against you. But suppose you are not maintaining your system properly, you are not using authorized software and hardware, you are not maintaining proper documentation, then you may attract some kind of legal action from the authorities. The next set of guidelines or instructions are about copies of record. So one should provide an investigator with reasonable and useful access to records during the inspection. All records held by the subject to inspection in accordance with predicate rule. So it says that whenever an inspector is visiting your laboratory, we must provide a record or we must provide data for the inspection. The agency recommend that you supply copies of electronic records by producing copies of records held in common portable format when records are maintained in these formats. Mainly you can give them tablets or you can provide them soft copy of documents using established automated conversion of or export method were available to make copies in a more common format. So you can use some internet based application in order to share your information with the inspector. Next is about record retention. So this record retention is a guidelines or you can say instructions given by US FDA in 21st CFR part 11. So the agency suggests us to decide that how to maintain record be based on predicate rule requirement that you base your decision on a justified and documented risk assessment and determination of the value of the records over time. So here the agency is giving some kind of free hand to us that we can take decision independently that by what means we want to record or we want to retain our record, but the only condition is that whichever method we are selecting, it should be reliable and the data or the record which we are storing or retaining should be reproducible at the time of inspection. As long as predicate rule requirements are fully satisfied and the content and meaning of the record are preserved and archived, you can delete the electronic version of the records. In addition, paper and electronic record and signature components can coexist as long as predicate rule requirements are met and the content and meaning of those records are preserved. That means once you are submitting data or record to the US FDA and once they are satisfied, you can delete that particular data. Normally nobody deletes data, but here there is an option. Otherwise what happens that you can still keep that data even if it is approved by the US FDA, and that is more advisable that whenever you have facility, you develop a storage facility where you can archive or where you can store your old data. So dear students, that was all about the 21st CFR part 11. Remember, this is a document in which there is detailed guidelines or you can say instructions given by US FDA to various pharmaceutical laboratories in order to handle the electronic data in a proper way. It is very important to handle this electronic data and the data should be reproduced during the inspection so that the inspection or you can say the audit by US FDA should be very smooth and it will go through very nicely and there will be no consequences or there will be no extra observations from US FDA. So the use of LIMS and the guidelines given in good automated laboratory practices ensure the integrity of data, and it will help us to go through the inspections and audit by US FDA very smoothly and successfully. Please go through the content of this video, and if you have any query regarding any particular topic, please let me know, so I will try to elaborate that particular point. Thank you very much.